Great. Bob, please.
Yeah, so I hope everyone was able to enjoy that conversation, because now it's time to work.
Thank you.
So thank you again for coming and taking the time out of what I'm sure are all very busy schedules. I'd like to just sort of start. I know many of you know each other, and I've met some of you previously, but if you could just go around the table and say your name, your role in this community, and importantly, you know, when I say the term a healthy community, what does that mean, and what does that conjure up for you? If you could sort of describe that as sort of a level-setting conversation, that would be great. And Ron, I'm going to start with you, largely because Matt is chewing. So if you could go
Matt,
first.
stop chewing. A healthy community?
Yes. Well, your name and.
Oh, my name.
Sorry.
My name is Rona Barrett. I've lived here in the Santa Ynez Valley just about 30 years now. I look good for my age under the circumstances, but I have been involved the past 20 years with being an advocate for seniors who are in need. And in this community in particular, you have no idea how many people are in need, how the 2007-8 recession absolutely destroyed so many people's 401ks or all the other kinds of savings that they had, and many women in particular lost their husbands and found themselves living literally on Social Security. So thanks to the president who brought Social Security to this country, it has been the lifesaver for many people, especially in this community. I could give you only one statistic. We are currently building and are almost finished with a facility called it's a campus, I call it, the Golden Inn and Village. And when all is said and done, hopefully we will be serving close to 200 seniors and other families that are really in need. In the first 2 weeks from the day we posted that the pre-applications would be available, we received 900 applications. 900 applications within 2 weeks, and on the first night, and it's a funny story because it was at 4 o'clock in the afternoon that the application would be ready, and we wouldn't get it any sooner than that. And around 5 minutes to 4, when the people in the Rona Barrett Foundation office noticed people were trying to look in the window, and she went outside, and there was a line of people down the hallway and out the front door and out the back door, waiting basically for needing help to work out these applications because they're just not easy. And when all is said and done, the applications come out to about this thick. So it was a real eye popper because that night we alone had submitted 156 or 59 applications, and the Housing Authority of the County of Santa Barbara, who's our partner in this, had already received another 100 some odd applications, and within the 2 weeks, 900 applications were there. Now I can't even tell you how many are now on the waiting list, trying to be vetted and trying to find a spot still in what we have, and we don't have enough. It just tells you we don't have enough, and no one wants to believe it. We've had too many people in this community at one point or another say, Rona, why do you want to build something that has for low-income people? Are you crazy? We don't want low-income people living here. I cannot believe this. I really just can't believe it, but that's the case. And I have nothing further to say. You can ask me another question another time.
CJ?
Oh, okay. As they hand me a cheesecake. How apropos. No. Charles C.J. Jackson. What am I doing here? I think I'm here in part because I represent a large employer, or maybe it's my involvement with the hospital, or perhaps that I'm a genuinely annoying person throughout the rest of the week. Actually, it's a person with a lot of energy and a very short attention span. I wanted to live in a small community. I just didn't know it until I graduated from college. And I didn't know it until I'd worked 10 years in Los Angeles that I needed to be here. I needed to be home. I needed to be in a place where I could leave an imprint, perhaps, or do something. But more importantly, if I did something, I want to be able to see what it was. I love everything about Santa Barbara. I'm a native. I'm fourth generation Santa Barbara. And I believe we can get things done in this community in ways that can't be done in other ones, because I have a forerunner, my father, who helped to revitalize the philanthropic community in Santa Barbara and channel it into a direction. So it was a tough act to follow, and he threw me into it in the deep end. So what am I? I want the 80-20 rule to change to the 50-50 rule, where 50% of the, or 80% of the work is done by 80% of the people, or something like that. But I love it here, and anything that can share that love and that enthusiasm for being a sense of place, a sense of community, and a sense of involvement, I'm there. So I guess that's why I'm here.
And what does a healthy community look like to you?
A healthy community is one of opportunity, one of vibrancy, one in which you see multi-generational participation. You take I know we're successful when some outrageously ridiculous idea that comes from somebody young is not only embraced, but ran with. And this county has had a whole bunch of those. So maybe we turn our attention to having those ideas focused on needs and making it work, and we can have a lot of scoring, a lot of touchdowns, a lot of stuff.
Great, thank you.
Doreen Farr, representing the 3rd District of Santa Barbara County on the Board of Supervisors, including this beautiful restaurant that you're sitting in right now. You know, county government does an enormous array of services. And I think, you know, specific to our conversation tonight with Cottage Hospital is, you know, the fact that we are responsible for physical health needs, mental health needs, social service needs, and are the ultimate safety net for people that are indigent and have, you know, all these different kinds of needs and need help with them. It's always been the role of county government. We're legally responsible in that way. And, you know, we're also the place where funds may be voted at the federal level or at the state level. Where the money actually comes to is the county to disperse, to do the paperwork, to make sure that it's used in the way that it's supposed to be used in many, many different ways. You know, I guess in thinking about, you know, how I would define a healthy community, I guess the first thing is that, you know, everyone in it, you know, has the opportunity and the ability to reach their full potential in whatever way that means to them. But I think specifically when it comes to healthcare, that you know, we're looking at, do we have services that reach all levels of need? So that's preventative care, that's routine care, that's urgent care, that's affordable and accessible to all ages, all income levels, and all needs, except for perhaps things that are very specialized and do need to go to a location like that. So, you know, I'm interested in this conversation. I have some questions I'd kind of like to ask myself because, you know, many years ago when the county had a hospital, and when the county decided to close the hospital, the agreement was reached at Cottage at that time that that Cottage would then be the community's hospital, would take over that county hospital role besides that. So there has been that partnership there ever since. And so, looking forward to ways that we can strengthen that partnership and talk about some of the ways that I think that could be made better.
Thank you.
I'm his lovely first wife. And I retired RN, and I thought, well, okay, now I will retire, and I decided to, I worked labor and delivery most of my career, and I then went to hospice to volunteer. Well, the families were taking care of me at the end, so I figured, well, that's not really a good fit for me, because they were comforting me more than I was comforting them. And so then I went to the senior centers, and they said, well, what can you do? Can you type? I said, not really. Can you file? Not really. Well, what can you do? I said, if I was pregnant, I can deliver a baby. And he said, well, we don't think we need this at the senior center. So anyway, I can do tables, I can do meals on wheels, I can do all kinds of things, and I can interact with these people. These people now who are 90 years old, when I was growing up as a child, 90-year-old people were in wheelchairs. They were not active whatsoever in the community. And now they're driving, they're active, they're alert. Some of them are a little physically disabled, but their minds are good. And there's a tremendous need for us to really kind of foster that independence with them and make them feel good about themselves. And we have art classes, and we have Tai Chi, and we have bridge classes. And it's just a wonderful thing that we can do for these people. These are very hard-working people in this community, and they have just given their whole lives to this beautiful valley of Santa Ynez. And I go to Buellton and I go to Solvang, and you see the same crowds everywhere. And they're absolutely, hilariously funny and interesting. Great senses of humor. They all want to feel like they're really human and vital. And they'll give you a bad time, which I think is a good idea. That's all I have to say.
Over here, over to you.
I'm Jim Richardson. I'm the mayor of Solvang. You ask about a healthy community. I think right now, we have a healthy community. As my wife mentioned, the senior citizens and the vibrant life that they live is heartwarming and amazing to see. And we have to remember too that we're a tourist destination, and we have a daily influx. The population doubles during the daytime, and I think that regarding health is we have to be aware that emergency situations occur, and those emergencies have to be ready to be handled at all times. Our normal population drops, of course, in the evening, and that's handled normally. But I think that and it's important to consider the population increase that we have during the daytime, during the weekends. I see the community as a vibrant, alive place. It's not. I don't believe it's depressive in any way in Solvang. I meet people all over the valley, and I'm running into smiles all of the time. People are genuinely happy and proud to be living in our valley, and I think it's a result of our population and the backgrounds of the people who moved here. And we've been here almost 20 years now, and I plan to bury myself here. This is the first place I can call home.
Now I'm cheered up.
Just to clarify, when you say this is a health community, you're referring to Solvang or the Valley or Santa Barbara County?
Well, I'm speaking primarily of the Valley, primarily of Solvang.
Yeah, okay. Thank you.
Hi, I'm Tracy Beard. I'm the Executive Director for the Solvang Chamber of Commerce. I've lived here 15 years, been the director for a year. What I see as a healthy community is an economic vitality where our residents are able to shop locally, and I mean shop locally, and not go outside of our walls at the same time. We do need to go out for other services. I think health is a big issue for our community, for our seniors, and for mental health. I think we still need to have those needs met for the community, the mental health needs. When you look around outside of Solvang, when you start driving, we go to other communities, we look within our valley, we see a lot of homeless, and I think those are still issues we need to address, and it does come back to mental health. And so to me, those are things I think that are issues that we do need to address within this community. But I think overall, on an economic level, we have a very vibrant community.
Thank you.
Yeah, my name's Jay Connor, and I'm currently the president of the San Ynez Chamber of Commerce. But my background, I came to the area about 35 years ago, and southern San Luis Obispo County, and I live in Santa Maria, so I've been in the northern Santa Barbara County pretty much off and on for the entire time. But I think speaking of the health, I would just deal with health just specifically as Rona did. You know, I think a healthy community to me is one that where there are needs that are met. And I think the most important thing is identifying what those needs are and reaching out, sometimes at the grassroots level, to where you go out, into the community, such as Rona's done. She's identified a unique need based on personal experience and family, as I remember, and brought that to light. And there was some resistance. It's a paradigm shift, and people didn't want to do it. But I think it's important that we identify those missing links or the unmet needs. Tracy mentioned homeless, veterans. I mean, we've got all kinds of aspects that are unique. And I think we all understand it. We hear about it all the time. But I think from my perception of a healthy community is one that identifies those needs and then has a program or structure that goes after those. Not trying to eat the elephant all at one time, but a bite at a time, identifying. And we talked about it, Elizabeth and I talked about it, Monica, the small successes. You don't try and get we don't want large failures, we want small successes. And I think this was what I see for a healthy community would be, let's identify these, because you're not going to be able to do everything at once. But I think successfully, you're going to be able to have a list, get a group of people together, and either small groups of people together and identify those and work on those. But don't try to be all things to all people.
Great, thank you. Yeah, we're going to get to that list in a second. Matt.
Okay, well, good evening, everyone. I think I know pretty much everyone. So I'm Matt Vanderlinden, Public Works Director for the City of Solvang. And I was actually kind of surprised to be invited to this event. I've been working in public works and the water industry my entire career, so I guess I'll try to frame my comments in that perspective. But as far and I've lived here 17 years in the San Ynez Valley. So and actually I think I kind of have a unique perspective because I live in Santa Ynez, right in town. I work for the City of Solvang, and I go to church and have friends that live in Buellton. So I'm like all over the valley. And my wife works in Los Olivos. So we pretty much got it covered. But anyway, but of course, initially when I hear the comment healthy community, I'm thinking of economic health. When you work for a city and public works, it takes money to repair sidewalks, to build new sidewalks, to do everything. And so, but I always think of people working together. One of the things that I'm a big proponent of is people working together rather than fighting and kind of being colloquial or territorial, But so people working together, good employment, low crime, opportunity like Doreen mentioned, people that have good morals and help their neighbors. That's what I think of as a healthy community from just a general perspective. But from people's physical health, I think about good air, good water, parks, recreational opportunities such as trails, and again, people serving, helping each other, and working together to make the community a better place. So that's pretty much it. I'm not I have a brother who is a doctor, but I'm not, definitely not very knowledgeable in the medical field, so.
Thank you.